Hi, my name is Dr. William Balanoff, and I've been a dentist for over 30 years. And I want to talk to you about one of the frustrations that you and I have as dentists. We know that we have patients out there that suffer from sleep apnea. We hear the stories of them snoring or them gasping for air. And we know what the solutions are. The solutions are to take an impression and send those impressions off to a dental laboratory where we get a custom manufactured mouth appliance which would advance their lower jaw, their mandibular advancement appliances. And that's all fine and good. The problem with that solution is it becomes really expensive for patients. And patients complain to us about the price of those mandibular advancement appliances. So what we try to do then is we try to mitigate the expense. We try to push the expense off to the patient's major medical insurance because major medical insurance will pay for it. The problem for you and I as dentists is that in order for major medical to pay for that appliance, they're going to want a medical diagnosis of sleep apnea. And this is where it becomes a little bit problem for us, a little bit complicated. In order for us to have a medical diagnosis, we need to have a medical doctor diagnose the medical problem. And then we're hoping the medical doctor refers the patient back to us for the device, which is the mandibular advancement appliance device, to help them with their sleep apnea and their snoring. So why does that become so complicated? So we have our patient who's suffering from sleep apnea. They're looking for a solution. They don't want to spend thousands of dollars on an appliance because the lab expense on these appliances could be as much as $600 or $700. And if we want to make a profit at the appliance and treating the patients, we're going to maybe charge 3 times the lab bill. So now we're over $2,000 for an appliance. Most patients can't afford that. They're looking for their insurance to kick in. So how does it really work out? So we have a patient with a problem. We refer them off to a sleep study center, usually run by a pulmonologist. The pulmonologist is going to conduct the study, bill the insurance company for the study. Now there's a medical diagnosis of sleep apnea. Here's where it becomes tricky. The pulmonologist, the person that you sent your patient to, all of a sudden is going to try and get your patient into a CPAP, where the air is being forced into their face and they're wearing this big bulky mask and patients hate it. Patient compliance is terrible. More importantly, it doesn't even really work all that well. But the medical doctor is getting paid for that appliance. So this medical doctor, this pulmonologist, the person who's running the sleep study center, is taking your patient, diagnosing the medical problem, treating that patient with a device that he or she is making money on. You as the dentist know there's a better solution for this. The patient never comes back to you. You never get the medical diagnosis, and the insurance company doesn't even know there's a better way to do this. So we have a pulmonologist who's making a medical diagnosis. We have the insurance company who wants to pay for a medical diagnosis. We want that patient to come to us. And the final and tricky little part to this is we have to fill out a medical insurance form. We don't even know the medical codes. And our admin, who's usually at the front desk, our office manager, doesn't even know how to fill out these medical codes. So even if the patient is qualified from an insurance standpoint and the pulmonologist does the sleep study and the sleep study confirms sleep apnea and the pulmonologist refers the patient back to us, we can't even bill the insurance company because of all of this complication, all these medical complications. And what you and I want, all we really want is just to help this poor patient who's not breathing properly when they sleep at night. So what's the solution? Well, thank goodness there is a solution which is easy to use, and there's a company in Germany that I found on my most recent trip over there last year. I went to the International Medical Show, which is every single year, called Medica, and I find this company there and I spend time with them and I learned that they've got an FDA cleared medical device to treat sleep apnea. And they have a couple of different versions of the same appliance based upon what you're trying to do for your patient and how much they want to pay. So let's kind of talk about this. So this is the SomnoGuard 3. This is the first one. Let me just take this out of the box here because it's so clever and so interesting the way they made this. The amount of advancement for the top and the bottom jaw is fit. So now the bottom jaw is going to be advanced, and that distance of advancement is always the same from patient to patient. So it's a typical boil and bite type of device. There is material inside here. When it's heated up, it goes inside the patient's mouth. They bite down. It brings their lower jaw forward. That jaw forwardness, how far the lower jaw comes anteriorly, is set based upon this device. So for a lot of patients, this is a great entry-level product to bring their jaw down and forward, to bring their jaw forward so that you open up the airway space so they're able to enjoy an evening's rest. Now, the more traditional approach to this is something that we've seen before. Let me just take it out of the box here. And what I mean by a more traditional way, and you're going to see this from a lot of dental labs. So the dental lab will make the appliance, which is this portion here, custom to the patient's mouth. So the best part about this now is it's boil and bite. So how do you bring the lower jaw down and forward? You have these little struts, and these little struts have different distances. So now you're able to take out one strut and you're able to adjust how far down and forward you're bringing the lower jaw. It's a very traditional way to make a sleep apnea appliance. So there's enough here in case the patient breaks one. The problem with this is the distance that you're bringing the jaw forward can't really be fine-tuned. So we started with something that's really good. This is better. So let's go to the best appliance, which is the SomnoGuard SPX. Here's the nice thing about this appliance, and this is what I really like. So you have the same little boil and bite appliances that fit, but the little struts, which you can see here, are adjustable by this little wrench. Why is that so important? So you can customize the right side versus the left side. You can literally customize it down to the millimeter of bringing the lower jaw down and forward. That's the reason why I really like this product the best. There are other patients out there who suffer from sleep apnea, but they're grinders. And the problem with the appliances that I just showed you is that when a patient grinds, they're going from side to side, and what they do is they break those struts. So the SomnoGuard AP2, same type design, where you've got a boil and bite disc that goes over the top of the arches. But here's the best part. There's actually a slide here so that when they bite down and they slide from side to side, they're biting down, sliding from side to side with their lower jaw or their mandible advanced. So the airway is still opened up. Their clenching and grinding habit, you can't stop it, but all you're doing is kind of working around it by allowing the lower jaw to slide from side to side on a rail system that's built into the boil and bite product. So what are we really doing for your patients? We're giving them sleep apnea solutions at boil and bite prices. So now, as opposed to paying $600 or $700 for a lab fee and then charging the patients thousands of dollars for the treatment of their sleep apnea, you can do this for a relatively inexpensive amount. So what I'd really like to do is I want to talk to you personally about this, because I want you to understand what these solutions are, how you fit patients, how much it costs. And the best thing for us to do is for us just to have a conversation. Give me a call. You can call me after hours because I know you're working during the day, taking care of patients. Give me a call on my personal cell number, 954-683-2693. Now here's the best part about this product too. No one wants you to have a ton of inventory inside your office, because who wants to have 10 or 20 of these appliances when you don't even know when you're going to need them? What you're going to be able to do is you're going to be able to call up Oral Care Perfected, and you're going to be able to order these appliances when you need them. We get them shipped out to you. They usually arrive in 2 days or 3 days, depending on the shipping method. Everything is FDA cleared, so you've got that assured that you're doing the right thing for the patient. Give me a call. Let's talk about something that you know your patients need, which is to be treated for sleep apnea. You and I both know that probably 70% of your patients snore or gasp for air. They're literally choking. The worst part about sleep apnea is if your patients suffer from sleep apnea, as many of them do, they've actually lowered their life expectancy because they're not able to breathe at night. They're gasping for air. And depending on the study that you want to quote, they're reducing their lifespan by sometimes as much as 5 years because of sleep apnea. So give me a call, 954-683-2693. Let's work together to help your patients have a better quality of sleep.